Good morning, everyone. We are now live for our event today. Thank you so much for joining us for the American Academy of Pediatrics Nevada Chapter Virtual Walk with a Doc Kids Time. I'd like to welcome all of our parents, kids, and fellow practitioners to our January virtual talk on our first talk of 2022. My name is Dr. Lily Hadaji, and I am a pediatrician here in Las Vegas, as well as the Nevada chapter of the AAP Walk with a Doc coordinator. For 5 years now, the Nevada AAP chapter has been meeting every second Sunday of every month. We coordinate kid-friendly talks on a variety of pediatric health topics and then enjoy an outdoor walk together. It's a really great way to get outdoors, learn important information about the health of our kids, and have the opportunity to ask a local pediatrician or pediatric specialist any questions. Our chapter also helps coordinate this event for the Reno community. So we normally join at the Springs Preserve's outdoor venue most of the year, and then during hotter summer months, we gather at the Mount Charleston Visitor Gateway to escape the heat. So since we're keeping our distance to protect ourselves and our community from this pandemic, we're holding a virtual walk with a doc this morning, live streamed online. For our talk today, we are really happy to welcome Dr. Terence Mcallister, who will be speaking to us about COVID-19 variants. Dr. Mcallister is a board-certified pediatrician at Desert Valley Pediatrics here in Las Vegas, as well as the secretary and treasurer of the Nevada AAP and the gun violence prevention advocate. Excuse me, as Dr. Mcallister starts his talk, I really encourage all of you to use this chat box to talk to each other and also ask any questions that he can answer at the conclusion of his talk. So Dr. Mcallister, we are ready when you are.
Great, thank you very much for that introduction. And I'm glad to be here to talk to everybody today. So I am going to talk a little bit about the COVID variants and what parents need to know about the COVID variants. So we started doing our remote Walk with the Doc talks back in April of 2020 when the pandemic really started to have an impact on our community. And at the time, we didn't know how long we were going to have to continue doing our talks remote. We just knew we would continue doing it until it was safe to come back to in-person. And now here it is, more than a year later, almost 2 years later. And at this point, we still don't know how long we're going to continue to have to do these remotely rather than in person. We are really just kind of keeping an eye on the facts and on the spread of this disease and doing what we can to keep safe. Our overriding priority here, the thing that we're always considering, is that we want to keep kids in person in school as much as possible. And we would hate to bring people together for a walk with the doc and have children there either get the illness or spread the illness and bring it back to one or more other schools and get themselves and maybe other kids having to be excluded from schools for 5 or 10 days or even longer. And so that's our goal. That's why we continue to do these talks virtually, because we want to keep kids safe and we want to keep kids in school in person as much as possible. So what are the COVID variants? So the coronavirus, like all viruses, mutates over time. This isn't something new. It's not something unique to coronavirus. It's something that happens to every virus, really to every organism. So these mutations occur randomly, and most mutations are not relevant. So they don't have any impact on the spread of the illness or the pandemic. Some mutations may be actually harmful for the virus, in which case that virus dies off. But if a mutation occurs that makes it easier for the virus to be transmitted or makes it more contagious, then that variant of the virus is going to spread, and it can spread rapidly. And so that's what these variants are. These are mutations that are naturally occurring in the virus, randomly occurring, that give the virus some advantage, some benefit to make it easier for it to spread. Now, some mutations can also make the virus more lethal, more dangerous, can have it cause more serious illness. And so when those two combine, when it's a mutation that makes the virus both more contagious and more deadly, then that's our biggest fear, because that can make the pandemic and the mortality related to the pandemic get much worse, much more quickly. So the first variant that we all heard about was the Delta variant, which became the most common mutation in the US last year. And that spread very quickly and caused an upswing in the rate of infections and worsening of the pandemic across the country and across the world. And the one that we're worried about now is the Omicron variant. And that was first detected in November of 2021 and has quickly become the most common variant, certainly here in the state, as well as across the country, and even in the whole world. At this point, we think it's probably the most common variant of the virus that's out there. So this new variant, it definitely is more contagious, and that's why it's spreading more quickly. Fortunately, it doesn't appear to be any more dangerous or lethal than previous variants. However, it becomes a numbers game. So, if the mortality percentage is the same, the fact that more people are getting sick, that means more people, the fact that more people are getting the illness means more people are going to get sick, and more people are unfortunately going to die from the virus. And so that's why we worry about it, that combination of being more contagious, and even if it's not more deadly, it is still a very deadly and dangerous virus. So the variants are increasing, the rates of infection are increasing, and so the pandemic continues. However, compared to where we were 2 years ago when this all started, we have tools now that we didn't have then. And because we have those tools, we can mitigate or minimize the impact of these variants and of the spreading of the virus. So what are those tools? First and foremost, and most important, I think, are the vaccines. So the vaccines, which were introduced just over a year ago, have had the greatest impact on putting a halt to this pandemic. The vaccines provide protection for everybody. So they absolutely provide protection for the people that get vaccinated, but because more people are getting vaccinated, fewer people are getting infected, and so there's less spread of the virus as well. And the more people that we're able to get vaccinated, the more we can decrease the spread. Now, in addition to just decreasing the spread, the other advantage of the virus, because it's decreasing that spread, is it decreases the rate of these mutations and the chance for us to developing a more deadly, more contagious variant. So those are why the vaccines are so important. Now, vaccines are not 100%. None of the vaccines that we give provide 100% protection, but the vaccine against coronavirus is very good. It absolutely does decrease the risk of getting the infection. And just as importantly, if you get the infection after you've been vaccinated, it decreases the rate that you retransmit it to other people, and you have less serious illness. So the people who are getting hospitalized and who are getting very sick from coronavirus right now tend to be those people who aren't vaccinated. And so the vaccine provides protection, even if it's not complete protection. The vaccines have been approved for everybody age 5 and up. Initially, it was approved just for adults, but over time, as more studies have been done, and as we've been assured of the safety for this vaccine in younger and younger kids, it's being approved for them. There are studies ongoing to approve it for children as young as 6 months. We don't know when that approval will come through, but the study is being done, the research is being done. But for now, it's been approved for everybody 5 and up. It is safe for children ages 5 and up, and it is effective for children ages 5 and up. And I certainly encourage every child and every adult who's 5 years old or older to get the vaccine. Now, as we learn more about the vaccines, we learn more about the dosing of the vaccine. And that's why we're continuing to recommend increased doses of the vaccine. We're hoping at first that a single or 2 doses would be enough, depending on which vaccine you got, but we now know it's not. The immunity wears off, and especially with the Omicron variant, it seems to be able to break through the vaccine rather, a little bit easier. So that's why a booster vaccine is now recommended. At this point, there are 3 doses recommended. 2 if you get the initial Johnson & Johnson vaccine, and then a second booster. If you get either of the other vaccines, then you need 2 doses, the initial series, and then a 3rd booster. And that's where it stands right now. We're learning more about the vaccines and more about the virus. There are studies going on in other countries that include a 4th dose. And so we're just gonna follow the science and see where that leads. But right now, the booster dose of the vaccine is recommended for everybody 12 and up. It's not yet recommended for everybody 5 and up. And again, that's just because we're following the science. Those studies are being done. The side effects and benefits are being looked at in younger kids. And eventually, when and if it's determined to be safe for younger kids, then the booster will be recommended for them as well. But right now, The initial series of the vaccine is recommended for everybody 5 and up, with a booster vaccine for everybody 12 and up. So that's our first tool. The second tool is testing. This is a harder one. So testing, yes, absolutely can be helpful. Knowing who has the virus, especially if they're minimally minimally symptomatic or have no symptoms at all, we still want to know when they're infected so that they can limit their exposure to other people. Which sounds great. The application of this is a problem right now. There is not enough testing available. There are at-home tests, which are effective. They're not quite as precise, quite as accurate as the lab testing, but they're good. But right now, it's very hard to find one. They're just not in supply. There are testing sites through the health department, as well as a lot of pharmacies will do testing. But again, limited access, limited number of tests, and it's hard to get. There is testing available at medical facilities. I do testing at my office. I think most primary care doctors do, as well as hospitals and urgent care. But because of the demand for testing, as well as just the amount of illness we're seeing right now, that's very limited as well. We can only see so many patients in a day and only have so many tests. So it's important to consider that. So getting tested just to have a test probably isn't necessary. Certainly somebody who's symptomatic, who has symptoms, should get tested. Somebody who's been exposed, especially if they are in a position where they need to continue exposing themselves to other people, like somebody who works in the medical profession or a teacher, then they should probably get tested as well to make sure that they don't have the virus before they continue with their job. But we do tell families that if one child in the family has been diagnosed with coronavirus and then a sibling starts getting those same symptoms, it's safe to just assume, yeah, they have the virus and keep them home, keep them away from other kids for the 10 days of symptoms until they're no longer contagious. And you can make that assumption even without the test to prove it. And then our final tests are masks. So a properly fitted face mask for everybody ages 2 and up is a very important tool for preventing the spread of this illness. The face masks protects the person wearing it from inhaling the virus and getting sick from it. It also limits, if they already are sick, the amount of virus that they exhale. So it decreases the risk of spreading it to other people. Now, there has been a lot of news lately about the masks and what type of masks to use. So a medical mask, a surgical mask, or an N95 mask, those are the best masks to wear if they're fitted properly, but they're not readily available. And so a cloth mask, especially a cloth mask that fits well, that has multiple layers, 2 or 3 or more layers of material, and especially one that has a filter in it, is nearly as effective as a medical quality mask. And so if you don't have those medical quality masks, using that cloth mask multi-layered with a filter is also a very effective tool at protecting your own health as well as preventing the spread of the virus. So as I said, masks should be worn by everyone aged 2 and older with very few exceptions. Now our chapter, the Nevada chapter of the AAP, has worked with the Nevada Department of Health and Human Services to produce guidelines for when there should be exemptions for the wearing of the mask. Now these are actually very rare conditions that prevent somebody from safely wearing a mask. Some of these things that we consider are a child with autism or severe developmental delays with sensory processing issues that just doesn't tolerate wearing the mask. Child who has developmental delays or limited physical mobility, so they would be unable to remove the mask themselves if they needed to. That can be a risk of wearing the mask. Some children or adults who have structural abnormalities with their face and neck may not be able to wear a mask. But even these exemptions aren't 100%. So we can work with kids even if they have some of those medical conditions. So children with sensory issues can over time learn how to adapt to the mask and to tolerate it. And so, even if kids are not able to tolerate it initially, we certainly encourage parents, teachers, therapists to work with them, to continue to encourage them to wear the mask, to continue to encourage them to put the mask back on. And over time, a lot of kids will get used to that sensation of wearing the mask and it'll become much easier for them. Kids who have the developmental delays or the limited physical mobility, so they wouldn't be able to remove the mask. Well, if they have enough supervision, if there's an adult, a caretaker, a teacher, or an aide with them who would be able to remove the mask if they're having any problems, then yeah, they can safely wear the mask while they have that kind of supervision. So the goal is to get kids when they're out, when they're around other people, to wear a mask. For those few kids that have a medical reason why they really can't wear the mask, we make exceptions for them, but we always try to work with those kids because for their own health and safety, it would be better for them to be wearing the mask. A lot of parents worry about other reasons why kids maybe shouldn't wear a mask. I've had parents ask me about their child with asthma, and they're worried about whether or not they're getting enough oxygen. Kids who have heart problems, or even children who are immunosuppressed, like a child who's getting chemotherapy because they have cancer, if they shouldn't be wearing the mask. And the truth is, all those kids that I just read absolutely should be wearing the masks. Those are the kids actually who are going to get much more serious illness from coronavirus if they get the infection. So they need to be wearing the mask. And there's really no risk from wearing the mask for any of those kids with those conditions. If you have concerns about your child, about a medical condition or developmental condition that you think makes it difficult or unsafe for them to wear a mask, talk to your doctor about it. And we encourage all doctors to look at this document of these medical exemptions. It's available on our website for everybody to review them, to see really what are the criteria, who are the kids who need to have an exemption for a mask, and what can be done for kids to encourage them or to allow them to be able to wear the mask, even if they have some of these medical conditions. So, excuse me. So the variations and the mutations will continue, all right? As I said, the mutations in the viruses is a naturally occurring process. But if we continue to use all these tools that we have, we can minimize the opportunity of the virus to mutate, and we can minimize the impact that those mutations have on us, and we can keep our community safe and healthy. One thing I'd like to bring up is that during this pandemic, because of the increased medical needs for everybody, Medicaid eligibility has been maintained for everybody, and it's just been kind of a default setting. And that's not always the case. And as we're coming towards the end of the pandemic, we hope those regulations, those exceptions may start to change. So we encourage everybody to check with your insurance provider. Make sure that your child is staying insured. Make sure that you're communicating with your insurance provider, that they have an up-to-date address for you. Medicaid often corresponds with people mostly through mail, through post mail. And so make sure that they have a correct address. And again, on our website, we have contact information so you can find out how to make sure that your insurance provider, that your Medicaid provider has correct contact information for you. We want to keep kids covered and insured through the pandemic and beyond, not just for health concerns related to the pandemic, but just for their routine medical needs as well. All right, well, thank you all for listening to me here today. I think that's all I have. Dr. Hadiji, are there any questions?
Yes, thank you, Dr. McAllister. So first question is, and I know you touched upon it in your talk, but should my child and I get the COVID-19 vaccine? What are your recommendations?
Sure, yes. So yes, my recommendations are that everybody who's eligible for the vaccine should get the vaccine. If you have specific questions about your child, if they've had problems with other vaccines in the past, or if you have questions about their immune system, bring it up with your doctor. Call your pediatrician and ask them those specific questions about your child. Most children can and should get the vaccine. I do get a lot of questions from people that what if they have had coronavirus, if they've had an infection, do they still need to get a vaccine? And the answer is yes. So we do know that the vaccine appears to provide better protection, better long-term protection than getting the virus itself does. Similar to a cold, once you get a cold, it doesn't protect you. You can still get another cold later that season or the next season. And coronavirus seems to be following that path. So even if you've had a coronavirus infection, it is still recommended that you get vaccinated.
Okay, thank you. Our next question is, if I've already had the coronavirus illness, should I still get vaccinated, and should my child as well?
Yes, yep. So as I just said, yes, so absolutely you should. Getting the virus itself does not give you long-term protection against getting reinfected. There is a waiting period. So the recommendation, I believe it's 6 weeks after you've had an active infection before you get vaccinated. But after that time has passed, absolutely you should get vaccinated.
Okay, great. And then our last question is, if my child and I are vaccinated, should we still wear masks?
Yeah, that's a good question. And that's a frustration a lot of people feel. We were hoping that once we got the vaccine out, then we could stop wearing the masks. And that's not the case. So the masks are still important. As I said before, the vaccines are not 100% effective at preventing spread of the illness. Masks are not 100% at preventing transmission of the illness, but the two together are highly effective. And so all of these things that we recommend, nothing's perfect. They're all things that are done to mitigate, to reduce the risk of the infection. So yes, I still would encourage everybody who's out in public. So kids who are at school, absolutely. When you're out shopping, anytime where you're out around other people, then you definitely should be wearing a mask, both adults as well as children over the age of 2.
Okay, great. Thank you so much, Dr. McAllister, for your very informative talk on the COVID-19 variants and your recommendations. And thank you to everyone who joined us today. So it's time for us to all go on our outdoor walk now. So as we stop the live feed, I really encourage everyone to take the time to enjoy some physical activity outside. It'll be great to see any photos of yourselves walking together that can be posted on the Nevada AAB Twitter feed at AAP Nevada. Make sure to walk for at least 20 minutes, bring some water and sunscreen, maintain social distancing, and wear a mask. We're keeping up to date on the latest recommendations from the CDC and American Academy of Pediatrics, and we will let you all know when it's safe to resume in-person walks. Please make sure to take your kids 5 and older, as Dr. McAllister also recommended, now for their COVID-19 vaccinations, and children 6 months and older for their flu vaccinations. And remember that these can be co-administered or given at the same time. Our next virtual walk with a doc will be held February 13th at 10 a.m. and we hope to see you there again. Stay safe and healthy and have a great walk. Thank you, everyone.